nutritional disease. Objectives of this lecture is to recognize the main characteristic of a nutrient-related disorder and describe the epidemiology of micronutrient deficiencies. So what is a nutritional disease? Nutritional disease involve any of the nutrient-related disease and conditions that cause illnesses in humans. They may include deficiencies or excess in the diet and the nutrients, overweight or obesity, and chronic disease such as cardiovascular disease, hypertension, cancers, and diabetes mellitus. Nutritional disease also include developmental abnormalities that can be prevented by diet such as a neural tube defect, hereditary metabolic disorder that respond to dietary treatment such as phenylketonuria, interactions of food and nutrients with drugs such as food high in tyramine like aged cheese may lead to severe high blood pressure in people who take mouse. Food allergies and intolerance such as lactose intolerance, gluten sensitivity, and egg allergy. Potential hazards in the food supplies such as hazards may be microbiological, chemical, or physical. And eating disorders such as anorexia nervosa and bulimia. Malnutrition. It refers to deficiencies, excess or imbalance in a person's intakes of energy and oral nutrients. It involves protein energy undernutrition, such as wasting low weight for height, stunting low height for age, and underweight low weight for age. Micronutrient-related malnutrition, such as micronutrient deficiencies, a lack of important vitamins and minerals, or micronutrient excess, and overweight, obesity, and diet-related non-communicable disease, example heart disease, stroke, diabetes, and some cancer. Undernutrition. Undernutrition refers to insufficient intake of energy and nutrients to meet an individual needs to maintain good health. It involves both protein energy undernutrition and micronutrient deficiencies. Causes and consequences of undernutrition. For the causes, it may be classified as immediate causes, underlying or intermediate causes, and the basic causes. Immediate causes include inadequate dietary intakes, example inappropriate breastfeeding and complementary feeding, and impaired absorption due to infection, disease, or inflammation. For the underlying or intermediate causes, household food insecurity, inadequate care or feeding practices, poor water, sanitation, and health services. The basic causes. The basic root cause of most undernutrition is poverty. This may be resulted from socio-cultural, economic, or political causes. It will affect access to adequate quantity and quality of resources, land, education, employment, income, and technology. The consequences of undernutrition. It can be classified into short-term consequences, long-term consequences, and intergenerational consequences. For long-term consequences, it includes increased morbidity and disability, and increased mortality. The long-term consequences, it includes impairment of adult height, impairment of cognitive ability, decrease in economic productivity and reproductive performance, and the development of metabolic and cardiovascular disease. Intergenerational consequences. Pregnant mothers without optimal nutritional intake will have children with suboptimal nutritional status, including impaired physical and mental development, increased likelihood for infection, and developmental delay. Micronutrient deficiency. Micronutrient is the term used to represent essential vitamins and minerals required from the diet to sustain all normal cellular and molecular functions of the body. Micronutrient deficiencies can have wide-range negative health impact that will ultimately result in death if untreated. Micronutrient deficiencies are often referred to as hidden hunger. Pregnant women and their children 5 years of age and younger are the most vulnerable population subgroups. This is a picture for the most common micronutrient deficiencies, and we can see that the iron, the iodine, and the vitamin A are the most common micronutrient deficiencies. Defining a deficiency. First, by the use of biomarkers, which are biological features in blood, urine, certain tissue, etc., that can be accurately measured and are used to investigate normal biological process, pathogenic processes, or pharmacologic response to therapeutic intervention. Biomarkers represent ideal and most standardized method for determining micronutrient deficiency. However, there are some limitations in their use. Biomarkers are not available for all micronutrients, while other existing biomarkers are not practical or feasible for widespread assessment. Biomarkers may be influenced by inflammation, infection, hydration status, age, kidney function, and analytical method. There is a number of issues existing concerning the use of cut points for biomarkers to determine deficiencies and insufficiencies, as there is a distribution around the cut point. Dietary intake data, not routinely collected in national surveys. Database reported intakes must be region specific and are often lacking or not up to date. Functional indicators, example stunting or low birth weight. It is problematic because many factors contribute to these public health problems. Multiple micronutrient deficiencies. Single micronutrient deficiencies rarely happen in isolation. More often, multiple micronutrient deficiencies are occurring simultaneously. WHO data estimated global hidden hunger indices for iron, vitamin A, and zinc to occur together in countries with the highest burden of multiple micronutrient deficiencies. Iodine may be the exception to clustering of micronutrient deficiencies, and iodine deficiencies is region specific and doesn't necessarily track with countries with a high hidden hunger. Strategies and interventions. Supplementations. Highly concentrated vitamins and minerals produced in the form of capsules, tablets, or injections. Used when micronutrient deficiencies is severe and requires a therapeutic approach to treatment, and can be used also for the prevention. Supplementation can be daily or intermittently, that is to say 1 to 2 times per year. Example, vitamin A supplementation for prevention of night blindness and infant mortality. Food fortification, addition of essential nutrients to a commonly eaten food vehicle. It is a more long-term strategy to combat micronutrient deficiencies than supplementation. Fortification differs from supplementation in that most of the population is exposed to fortification, whereas supplementation is targeted towards certain individuals or groups. When there is a widespread micronutrient deficiencies, fortification is the tool with the greatest capacity to reach the most within the country. Example, iron fortification of wheat flour and iodine fortification of salt. Dietary diversification, increasing both the quantity and the range of micronutrient-rich food consumed. Changing the dietary patterns of the individual and the communities may be difficult to achieve, and dietary diversification may not be possible due to limited food availability within certain regions. Example, addition or change to complementary feeding practice when an infant starts to consume food other than breast milk or infant formula. And thank you for all.